My next guest, Tania de Jong, is a singer, actress, star of the stage, but she's also been a tireless campaigner for mental health reforms. She was named one of the 100 most influential people in psychedelics globally for campaigning for the use of psychedelics to treat mental health conditions. It can be a highly controversial issue, and there was a major development last week with Australia's medical regulator approving the use of the drug MDMA for the treatment of depression and PTSD, and even elements of magic mushrooms have gained approval. Tania de Jong, Executive Director of the charity Mind Medicine Australia, joins me now. Can you tell my audience a little bit about what led to this legalisation by the TGA? And a lot of people will find this confronting because we know mushrooms and ecstasy can be very dangerous.
Well, actually, that's a bit of the stigma and prejudice that is attached to these medicines. So in 1970, Nixon had his war on drugs and politicised the use of these medicines, which had proved to be very, very effective in treating patients with post-traumatic stress disorder, depression, addictions, even relationships therapy. So in the 50s and 60s, tens of thousands of patients underwent these treatments. When he politicised and made these medicines illegal in 1970, research funding stopped. And in the last 10 to 15 years, there's been a major renaissance in this field. And Mind Medicine Australia was set up by my husband and I in 2019, so we're celebrating our 4th birthday next week.
And this is quite a triumph because a lot of people thought this wasn't going to happen as quickly as it has.
Certainly not in Australia. So for Australia to actually lead the world, for the TGA to make a decision like this is extremely significant. And it's because we have a major mental health epidemic, which I think we all recognise in our families and communities and workplaces. And unfortunately, with current treatments, only a small percentage of patients are getting well. So in the case of depression, about 30% of patients get well through current treatments. In the case of post-traumatic stress disorder, as few as 10% of patients are getting well through existing treatments. With psilocybin and MDMA-assisted therapies, 60 to 80% of patients are going into remission after just 2 to 3 medicinal treatments with a short course of psychotherapy.
Okay, well, I'm not a doctor, so I can't question the veracity of that, but you did mention we're going to be world leaders in that. Australia is the first country to legalise these drugs. Is that a fantastic step forward? Are we progressive, or perhaps are we being used as guinea pigs here?
No, I mean, it's very progressive to see Australia doing this. I mean, these medicines have been used legally in a number of countries. So they're legal in the Netherlands, where my husband and I, went for this experience and had healing through these medicines ourselves a number of years ago, and they are legal in a number of other nations. They've been used in South America, for example, in Indigenous cultures since the beginning of human civilization for healing and raising of consciousness and so on, and through ceremonies.
But do you have any fears that this is going to be misused, that it's not going to be just people suffering PTSD or depression, it's going to become an accessible drug that people just want to experience because they want to have a
trip
high
or something. No. Well, I mean, the controls around this are very, very tight. So the TGA has specified that only authorised prescribers and psychiatrists at that can use these for treatment-resistant patients. So these are patients that have tried a lot of other treatments. It is actually a risk for them not to be treated because they could become suicidal and take their own lives, which would be an absolute tragedy, and there's been many examples of that. And we also have a lot of military, defence veterans and first responders and others who've given an enormous amount of themselves, and they're suffering extreme mental illness and depression, addictions and so on, and they're not having a chance to get well. So we need to really focus on getting a lot more people well, and this is the way forward. It's the new frontier in the treatment of mental health.
Well, we're keeping a close eye on it, and you have had quite a triumph with this, because I know you've campaigned, both you and your husband have campaigned tirelessly for this, so we'll keep in touch and see how it keeps progressing. Thank you so much for joining me.
Thank you. It's great to see Australia lead, hey?